a way for the party to address how to cover those who have a high risk. If you had cancer before or disease before, or you come from a family where that is the case, heretofore and even before Obamacare, you could be prevented from getting any type of coverage or pay through the nose for this. Now, in Maine, you don't pay through the nose for it. It's handled through this sort of high-risk pool the state is handling with the government, and whether the state picks up the cost or the federal government picks up the cost, they just want that ironed out, and therein lies the rub, whether what they're doing to make sure that's addressed is just not another costly government program, as Judge Napolitano was raising on the last show here. That will be the decider here, whether we get health care coverage or a repeal and rework plan submitted to Congress this week and up for a House vote maybe as soon as tomorrow. We just don't know. But that is where this battleground is being joined. Former South Carolina GOP Chairman Van Hipp, Manhattan Institute Director of Health Policy, Paul Howard. Paul, do you think that the Republicans can iron out these differences in time for a yay vote, whether it's tomorrow or Friday or Saturday?
Look, that's an excellent question. The bottom line here is they can construct a program that says, look, can a state prove that if they want to move to a different set of arrangements, a reinsurance, what they call a high-risk pool, that it offers an affordable option? I think they can get there. And I think the important thing is to just get to the right policy, worry about the vote later, because it'll take care of itself once you've got the right strategy.
All right, but the fear seems to be, Van, that they won't get to a vote until they iron this out, and delay is costing them a great deal right now. The president wants a quick vote. I had Phil Gramm on, the former Texas senator, said, hearkening back to the Reagan era, that, you know, these quick votes are important to get because it puts people on the spot, and he wouldn't be surprised if a lot of no votes there turn out to be yes votes. So there is an urgency to voting right now. Yeah. What do you think?
I think Vice President Walter Mondale once said anyone who claims to be an expert on North Korea is either a liar or a fool. And I think the same can be said about health care. But I think it's important,
and
Neil.
Can you imagine health care in North Korea, what that would produce?
Well, and that's what's on this president's plate right now. And the sad thing is he should not be in a position right now of having to sign Obama's budget deal. I think he got some bad advice back in December to agree to a continuing resolution. He's had to spend so much time putting together Obama's and the last Congress's budget deal. But I think it's important for Republicans to get it right instead of getting it quick. Don't forget, it was Obamacare that largely led to the Republican takeover of Congress in 2010. We don't want the GOP walking the plank in 2018 and Trump care leading to the Democrat takeover of Congress. They've got to get it right, and I think they need to spend whatever time it takes to get it right.
You know, the only reason I would ever disagree with Van Hipp on this, Paul, is A, he's on remote, so what can he do? The other is, I think there is something about speed in this case, not always justifiable, but you'll never get the conditions just right for a clear vote, and there might be something to putting all of these congressmen on the spot, yay or nay, and they might be pleasantly surprised because everything hangs in the balance. And you could make the argument that anything they come up with would be better than what it's replacing. That's what Republicans say. What do you say?
Well, look, the other point, Neil, you could make is let's give it over to the Senate. I think that based on the balance of power there, you've got a very narrow margin. The Senate's going to wind up making changes to this legislation when it gets there. You're going to have the same challenge between moderates and conservatives.
Why is it beginning in the House? Is that the way it's just going to go? Or?
It's because of the reconciliation procedure. It has to start in the House, but once it gets over to the Senate, you're going to see a whole other debate here. So that's really, I think, where the rubber's going to meet the road, is what the Senate's going to do and what they're going to send back to the House.
All right. Van, the only other issue that comes up here then is the cost of this, because if they do guarantee pre-existing conditions, if they do leave it to the states to offer a little bit more flexibility, what you're doing in the end, to your earlier point, is replacing one big omnibus unwieldy program with a slightly less big omnibus unwieldy program. And in the end, is that advantageous, or is it worth it if it greases the skids for something that they can go back to their voters and say, well, we have something that's better than what preceded it, and we can begin with the tax cuts that everyone seems to like?
Neil, I believe you got to have the pre-existing conditions in there, something the president campaigned on. There's a report out I saw 5 hours ago where the president says it's in there. Look, I'm a 10th Amendment man. I believe in whatever is not given to the federal government, it belongs to the state but I think it's the right thing to do. It's one of the reasons I think why this president was elected. He campaigned on it just as he campaigned on meaningful tax reform, repealing Obamacare, and he campaigned on building the wall. And those are the things what I hope this president will do. He connects so well with the American people. Get on Air Force One. Go to those swing states. Go to the Rust Belt where those Democrats are up for election in 2018 and urge his people, urge the base, urge the forgotten Americans to come out to put pressure on those Democrats to support his package.
All right, guys, thank you both very, very much.